Today is World Health Day, a day to celebrate the work of health practitioners and workers who keep us healthy. The coronavirus crisis threatens our health, but also our societies and economies. But it does offer us an opportunity to rethink our priorities and systems to make them sustainable, inclusive, and in line with the SDGs. FEMISE contacted researchers, partners, and young people from the Mediterranean to listen to their views on the implication of this pandemic and to remind everyone why investing in health matters. Let's hear them out.
Our thoughts go out with those who are most affected by the COVID-19 pandemic, particularly those who are rendered most vulnerable. The impact of COVID-19 pandemic can be even worse in many developing countries that lack universal health coverage of both populations and services. All health sector stakeholders are urged to act in an integrated and patient-centered way to minimize the catastrophic and impoverishing effects.
What I found very interesting was how the government was going to tackle the communication with the population, as we know that a very significantly low percentage of the population has no daily access to internet, to TV or radios. As a consequence, the government has found alternative means of communication. On the ground, we have been noticing that the civil society is also pretty active. But the health sector needs additional resources. We have very few resuscitation devices, we have a lack of beds. Measures that have been taken in European countries are not adapted to the structure and the cultural habits of Moroccans.
Lebanon already had a lack in medical supplies, with medical practitioners and even official warning that hospitals soon would not be able to provide patients with urgent medical care because of the financial crisis. The situation is still under control. The country borders are closed and the number of positive cases are still lower than 1,000 cases. But this is not the final number, as the tests are limited and expensive. Also, not all the people have the same access to medical treatment. The poverty level is high and there's a limited financial help from the government.
What we can see from the crisis is that the hospitals have been running out of beds and medical resources to treat patients, and that in many of the countries the health infrastructure is actually lacking or is compromised. Of the Mediterranean countries, policymakers need to address the state of the public healthcare system. Investments in better health facilities and means that uncover all territories is absolutely needed. And in France in particular, we need to train more medical personnel to relieve the current workforce shortage. Mediterranean countries should provide assistance to each other when a crisis like this happens.
In the coronavirus pandemic, the importance of gender equality is clearer than ever. Women in the Mediterranean and all over the world are pillars to their country's health sectors, as this sector is a growing employer for women and greatly contributes to gender equality. But women are also pillars to the overall well-being, holding their families and societies together through healthcare, childcare, online education, as social workers, etc. Therefore, more than ever, South Mediterranean governments should become self-aware and uphold and strengthen the rights of women.
Aujourd'hui, la meilleure défense contre une pandémie, c'est un système de santé solide. Malheureusement, le Covid-19 a révélé dans le monde un système et services de santé assez fragile, et les pays sont obligés de faire des choix difficiles pour répondre au mieux aux besoins de leur population. Dans les pays du sud de la Méditerranée, le choc va être très violent. Pourquoi ? Parce que le système de santé n'est pas comparable à celui des pays développés qui est lui-même dépassé. L'impact économique et financier, lui, sera assurément élevé. Le monde ne sera probablement plus le même après le Covid-19. Cette crise sanitaire doit nous permettre de revenir aux fondamentaux. Il va donc falloir être solidaire entre individus et nations, rebâtir un système de santé publique solide et surtout réapprendre la science de la prévision et de l'anticipation.
Après la sidération causée par le Covid-19, il est temps de laisser place à plus de froideur d'esprit, de distanciation, de questionnement pour comprendre ce qui nous arrive et surtout pour prévoir l'avenir et la construire dès à présent. Antoine, des actions fortes doivent être menées pour que cette épreuve malheureuse soit instructive. Ces dernières doivent porter sur des aspects plutôt prosaïques en mettant en exergue le rôle des capitaux humains dans le développement et le bien-être des nations. L'investissement dans la santé et le système sanitaire a un impact positif, significatif et robuste sur la croissance économique et le bien-être. C'est un levier pour redonner la confiance qui manque aujourd'hui tant au marché financier qu'aux acteurs économiques, c'est-à-dire les entreprises, les citoyens et les organisations non gouvernementales. Mais face au danger, le maître mot doit être le même, investissement massif dans la santé, c'est-à-dire dans l'humain. Il faut se remémorer la formule de Jean Baudin, est né de richesse que d'hommes.